Thanks, Rick. Good morning, everyone, and welcome to today's webinar, Real-World Solutions to SEG Management Challenges. I'm Ed Witkowski, Editor-in-Chief of The Synergist, the magazine of the American Industrial Hygiene Association. Thank you to all listeners for attending today's event, and I'd especially like to thank our sponsor, Medgate. Medgate is a leading environmental health and safety software solution used by industrial hygienists and health and safety professionals across a wide range of industries around the world. Medgate software is developed and implemented by accredited EHS professionals with real-world experience. We have two presenters this morning. Monica Melkonian is the Industrial Hygiene Product Manager at Medgate, providing technical expertise, guidance, and support in the development of Medgate's Industrial Hygiene Suite. Previously, Monica worked in the environmental and occupational health field for over 15 years, including California EPA, Oregon OSHA, NASA, and as a private industry consultant. Our second presenter is Joe Loro. Joe is a senior sales executive at Medgate, where he provides subject matter expertise for industrial hygiene and safety projects. Joe has worked as an industrial hygienist for public and private agencies, including Central Arizona Project, MBNA North America, and SEG. Okay, Monica and Joe, now I'll turn the presentation over to you.
Thank you, Ed. Joe and I look forward to sharing with you what we believe is a unique perspective on the challenges the profession faces, defining and managing similar exposure groups, otherwise known as SEGs. My experience entails over 18 years of industrial hygiene experience within the government and private sector, and over 8 of those years as an industrial hygiene software product manager and consultant for global clients across a broad range of industries.
And my name is Joe Loro. I've been a certified industrial hygienist for a little over 10 years now. I've got 22 years as an industrial hygienist itself. Nearly 15 of those years have been spent primarily in the private sector. And for the last 7 years, I've been a sales executive with Medgate, specializing in industrial hygiene software sales.
Before Joe and I dive in to the session regarding the challenges and solutions to defining and managing SEGs, we wanted to kind of reflect back on, why we want to define SEGs in the first place. What are the benefits? And there are many benefits for doing so, including having the ability to proactively and efficiently anticipate, recognize, evaluate, and control risk in the workplace, as well as serving as an excellent tool to harmonize your risk management with the opportunity for data sharing and lessons learned. So it's a fantastic tool to allow the hygienist with, oftentimes minimal resources, the ability to really tackle those risks in an efficient fashion.
Right, Monica, and well-defined SEGs, keep in mind, when they're established, you have the ability to establish any regulatory requirements for those SEGs and then document that compliance with those requirements.
Conversely, the risks of poorly defined SEGs entail things such as reactive response to risk, mischaracterization of risk, and possibly misallocation of resources trying to obtain the data or controlling risk. Joe and I have worked with a wide range of organizations globally, and it's really provided us a unique window into the challenges that confront the profession and the solutions that differentiate those that can have successful programs and those that have more trouble getting to their objectives. We have found that through the process of implementing any EHS software solution, it really serves as a catalyst to evaluate and improve how SEGs are defined and managed. In fact, when we first meet with a new organization, we'll ask during our business process review if they do have a fully defined list of SEGs. And surprisingly, over 50% feel they really do not have a complete list at hand and are very interested in actually having that complete list. And the common thing that we find for all the cases where we have organizations that don't have a complete list, the challenges are the same. And one of those large challenges is historical data. Unfortunately, over time, if data is collected, the data may have been stored in various locations, whether it be hard copy paper, perhaps Excel spreadsheets, maybe miscellaneous homegrown database systems. Needless to say, stored in various locations with maybe partial or incomplete data sets at hand. Also to quality, maybe of concern if the data that was recorded over time wasn't done well in a fashion that the quality was truly trusted. And thirdly, retention. Many times, and even when I was in the field with, just having that data available to you as things may change across the organization.
Right, and Monica, one of the issues that a lot of organizations face is, when there's turnover within the industrial hygiene department, a new industrial hygienist walking into an organization a lot of times doesn't have a grasp on the work that was done by the previous industrial hygienist. I know that I had to deal with this in my past experience, and I'm sure that many of you on the phone today listening to this webinar have similar experience. And without some type of a system in place for well documenting your SEGs, they may not move on to the new industrial hygienists as their turnover occurs within an organization.
That's definitely right. So with that, lack of historical data or missing historical data, it makes it really hard to even get your foot up on getting your SEGs initially defined. In addition to that, even more critical is present data, what data you have at hand on current operations. Of course, it takes time and resources to collect that data. We don't have enough to sample every nook and cranny of every part of a facility across an organization. It needs to be strategic. And that data that's collected is an asset. It's highly valuable. The access to the data is critical, and we do see it, as with the historical data, the present data and its accessibility can be a challenge, whether it's stored in paper files, Excel systems, miscellaneous homegrown databases and so forth. Accessibility is a challenge, as well as communication. If that data is not at your fingertips, you're not able to interpret and really communicate that data the way you would really want to. And sometimes there's just lack of harmonization on how that data is collected and interpreted, and that can pose its own challenge, as well as data sharing, especially if an organization has similar operations in various locations. Having mechanisms in place to do that data sharing so that you can leverage your resources to the maximum and control risk.
Right, and just to further on that point, Monica, talking about the resource allocation and present data, when I'll speak to an organization that's looking for industrial hygiene software, one of the questions I'll ask them is, do you document your qualitative exposure assessments? And a lot of times, they'll say, no, we really don't do that. And the bottom line is, yes, they do it. Whether it's documented or not is a different story, but there must be some rationale behind where they're going to be doing sampling, whether it's documented or in their head. There is rationale, and that is a qualitative assessment. So I just wanted to bring that up as well.
Absolutely. Another challenge that Joe and I have also seen is just managing change. And what we've seen is there's two broad categories that are common. The first being operational changes. It could be job or process or procedural changes that may increase risk or change the nature of the risk. Equipment changes, work practice changes, as well as just basic EHS observations or employee observations that may draw attention to some change in the workplace. Also, too, we're seeing this more and more as companies evolve, is administrative changes. We're seeing quite a bit of mobile workforces as well as heavily used contracted workforces, even tiers of contracted workforces, Tier 1, Tier 2, Tier 3. So that can be really more challenged to nail down what the workers are doing out in the field and getting those in their SEGs. As well as mergers and divestitures. We deal with a number of companies that are either absorbing new companies with new operations and new risks, or sometimes divesting of operations or units that Unfortunately, or hopefully, the data that was part of that operation properly gets absorbed into the new company that has purchased that unit. So there's a lot going on with changing operations and the hygienist trying to get a hold of their SEGs.
Right, and think about this when you walk into an organization. One of the key factors on defining your SEGs is determining how you're going to do that. Are you going to look at SEGs based on agent, by job position, by work area? Any given organization may have any combination of those factors used when determining how they're going to manage their SEGs within that organization.
So, and above and beyond that, so we have historical data challenges, present data challenges, managing change. So we get through all those challenges. We get to the point where we can actually define our SEGs. In this example here, just a very small piece, if we have a refinery operator, 2 different processes occurring at 2 different facilities. We've gone from 1 job position that's now into 3 different SEGs. You could imagine across an organization, this tree structure could easily bring perhaps a company operating globally into the hundreds if you were to count the number of SEGs they need to manage. So just that, a fully defined list of SEGs and managing that volume of data.
Right, and Monica, also keep in mind that well-defined SEGs serve as the foundation for effective management of other industrial hygiene-related programs like hearing conservation, respiratory protection, medical surveillance, just a few of them. You know, a solid foundation using SEGs is really the basis for managing a lot of those programs.
Now what we'd like to do is open up a poll. It's open for the next 2 minutes, and we'll discuss the results at the end. And the question for you all today is, do you feel your organization has a well-defined list of similar exposure groups? So now that we've talked about the basic challenges that confront the profession when trying to define and manage similar exposure groups, we definitely want to start talking about solutions. And before we do that, we want to just talk about some of the fundamental principles of SEG definition and how most in the profession approach it. And what I have here in this slide is the American Industrial Hygiene Association's Exposure Assessment Strategies solution, that 3rd edition, that outlines some best practices regarding risk assessment and how exposure groups should be defined and managed. My understanding is the AIHA will also soon be releasing a 4th edition, which is exciting to hear, and we'll look forward to seeing that soon. So the basic concepts here is that, and we all do this, as Joe had mentioned, we all kind of do this in our head, but unfortunately some of us, we don't have that fully documented, so that's kind of one of the critical pieces. But we'll go into a basic characterization of an operation, establish our similar exposure groups, define those exposure profiles for each of those groups, and then compare that profile against the OEL and the certainty levels that we have. At that point, you know, determination can be made of, A, is the exposure to the group acceptable? If so, then reassessment should still be called for. The reassessment schedule is set, every company is slightly different, but set different time for reassessment. It could be annually or twice a year, however often the organization decides to do that. If the exposure is determined to be uncertain, then further information gathering should be done. So collecting more data, more samples, et cetera. That kicks us back into the basic characterization again as well. And lastly, if the exposures for the group are determined to be unacceptable, then the hierarchy of controls will need to be implemented, whether it be substitution of materials, engineering controls, administrative controls, PPE, et cetera. And important to that is a feedback loop to validate that those controls were adequately controlling the risk as well. So you can see this whole process, it's iterative and it's cyclic and it's continual. So it just doesn't stop. You just don't define your groups and end it there. It's an ongoing process of continual improvement and reduction of risk. If you were to go to the American Industrial Hygiene Association's Exposure Assessment Strategies book, 3rd edition, they define similar exposure group as a group of workers having the same general exposure profile for an agent because of the similarity and frequency of the tasks they perform, the similarity of the materials and processes with which they work, and the similarity of the way they perform the task. And as Joe had mentioned earlier in the session, these are some of the common ways individuals will define an exposure group, and is also in the AIHA Exposure Assessment Strategies. It could be one or any combination of these components that may help define the similar exposure group. It could be a task, an agent, process, perhaps a job classification, or possibly a work team, or even a unique subset of SEGs that relate to non-repetitive tasks or jobs. And when we implement with our clients, each client, and depending on the industry they're in, they may take any one of those approaches in combination. So each organization has their own.
Yeah, the one thing that I found is that when it comes to SEG management, no two organizations are the same with the way that they manage SEGs. As Monica said, some are by task, some are by agent, some are by process. There's no right or wrong way to do it. It's whatever is best suited for that organization.
Right. I must say, Joe, that's one of the larger challenges we have is, folks want to have kind of like this holy grail of this is how you do it, Well, should I do it by task? Should I do it by process? So how should I do this? And it's like, it really depends.
Right.
So it's an art form, and it takes a lot of good professional judgment, decision-making, and access to some good data to make it happen. So some of the important inputs to defining SEGs, these are just some examples, is identifying the hazard sources, making sure you have your exposure limits at hand. What kind of routes of exposure are we dealing with? Is it inhalation? Is it dermal, et cetera? What kind of controls do we have in place? What work practices are the employees undertaking? And maybe what kind of personal protective equipment they may be wearing. Another piece of importance is the reassessment protocol and the controls and validating their adequacy. And here I present to you the AIHA chart again regarding the basic characterization. And you can see here on the far right, we kind of have a hierarchy of control cut points from no action required if the risk is minuscule, all the way up to risk levels of 4, which would necessitate, hierarchy of controls and validation of those controls. And this plays a critical role in this whole component of everything from acceptable exposures and uncertainty all the way down into here. All this plays a role as we go into our overall characterization. And as I mentioned briefly before, the importance of validation. If any of you have been fortunate enough to go to any of the sessions at the conference regarding professional judgment and decision-making, Bayesian statistical analysis, I think we've all learned increasingly the importance of validation of our professional judgment and also of the controls that we've decided to put in place. And so, having the data sets available to you, having reporting mechanisms to draw that data out, run your traditional and your Bayesian statistics to validate that the judgments that are being made regarding your SEGs are on mark. We have another poll for you, and again, you'll have 2 minutes to complete the poll. And the question now is, do you use the AIHA Exposure Assessment Strategies approach when defining and managing exposure groups? So Joe and I have covered, the AIHA model and how helpful it is in helping us define, manage, and validate our similar exposure groups. Above and beyond this, Joe and I have found that there are some critical differentiators for those that are able to achieve maximum success in defining and managing those SEGs. First of all is those organizations that have an effective archival and access to historical data. They have efficient information gathering and recording of present data. They have open lines of communication to quickly identify and respond to change. And they have a harmonized best practices and the ability to leverage lessons learned. And that last bullet, and Joe, I'm sure you could speak in soon after, harmonization sometimes can be quite challenging, especially with companies, organizations that are operating on a global fashion.
Right, absolutely. I mean, you know, with the harmonization and having the ability to communicate between departments within an organization, it's of eminent importance. I look at organizations where industrial hygienists are the ones that are determining, you know, who's in a SEG, and then medical department is determining what type of medically related activities do they need to have, and then executing on those activities based on the exposures that they have at hand. And having an integrated system where all of that data is captured in one central location and shared amongst those disciplines is, you know, it's hard to say how important that is. It's something that I know that I feel is very important. It's benefited me in the past within my organizations that I've been an industrial hygienist for, and I'm sure that it would benefit some of you on the line.
Absolutely. I think it really helps drive efficiency given our limited resources at hand. Efficiency, and also helps enhance accuracy of our work. So what Joe and I would like to do is tell you a few success stories that we've had. And Joe, I'll let you kick it off with your first story.
Right. So I wanted to talk about my experience with a utility company that I was an industrial hygienist for. When I walked into the job position, I do speak a lot of this from experience because, as I was mentioning, walking in as a new industrial hygienist and not having access to the data that the previous industrial hygienist had done. The previous person in my position was using an Access database that I really had no idea how to use. I'm an IH, not an IT. And so, you know, I went into the organization and had limited amounts of data and really didn't have a good grasp on how the SEGs were defined. We also had, it was a quasi-governmental entity with a union mentality of the employees. We didn't have an on-site clinic, so everything from a medical surveillance standpoint was done off-site. At the end of the day, when I was managing those, trying to manage those SEGs, we had about 13 different SEGs based on agents. So we had an asbestos SEG, we had a lead SEG, we had a noise hearing conservation SEG, we had numerous other SEGs. And one of the things that I was able to do was align those SEGs together so that as the employees were going to the third-party administrator for medical surveillance, they weren't going every 2 months. The most stringent requirement was lead, which was every 6 months. So I had the employees that were enrolled in medical surveillance programs, after defining the SEGs, would go every 6 months to the medical service provider to get any tests that were coming due in the next 6 months out of the way. After the first year, they were all on the same schedule, that every 6 months they would be going and getting all the tests that they needed. And what that was able to do was it saved the company over $100,000 a year from reduced employee time away from work for medical surveillance programs, where they were going 5-6 times a year at 3 hours a pop. Now they're going 2 times a year. You times that by 1,000 employees, and the numbers will speak for themselves. So it was a great way to harmonize my SEGs along with the medical surveillance program and save the organization money.
And a success story that I could share with you is in the petroleum industry. This particular organization had a really strong formal exposure assessment program that was harmonized across the organization. It was mandated to be followed. The training of the industrial hygiene staff when they first joined the company was at least a day or so long, just in the risk assessment protocol that would be followed. So it really drove best practice across the staff. And they had a very robust means by which they stored their historical data going back decades, and also a rigorous system to record in a common system, the data that they were collecting present day. They were able to take all that data and really help identify their critical SEGs and ultimately manage up to 500 SEGs. So they were able to get to stage 1. They were able to get to define all their SEGs, and then at that point they were able to then continue management of those SEGs in a quite efficient way, just by having control of their programs, harmonizing them, training their staff, and really having control of their data. Another success story that I've seen is around the transportation industry. This particular organization, just in one program alone, those employees that had to be part of a respiratory protection program, they were able to save about $700,000. Excuse me, they reduced their annual costs from $1 million to $700,000. And they all did this through the ability to automate those individuals that were part of the program, making sure that those that really needed to be part of the program were in, and then those that didn't were out, so that we weren't expending extra resources where they didn't need to be. And it really helped improve their compliance and their reporting. So quite enough savings if you want to look at just the bottom line financially, as well as, of course, what we all care about is worker health and safety. So we've talked a little bit about success stories, and again, what we think the keys to success and the differentiators for organizations that are able to have good control of their programs is they do have strong, formal, harmonized program. They have strong industrial hygiene leadership. They have an owner where they're instilling in the whole industrial hygiene staff the program, its importance, and the training that's needed for that, for all the staff to comply with the program requirements. And, of course, command and control of the data, both historical and present. If we don't have that valuable data, we're really kind of hunting in the dark, trying to make the best decisions, our best professional judgment and best decision-making. And lastly, one of the key factors as well to a really good program and success is validation. Validating our professional judgment regarding the SEGs that were defined and making sure that the definitions are true and accurate. And so Joe and I just are going to walk through a few slides just showing you some examples of some of the differentiators of working with your SEGs. First of all, the definition of SEGs and harmonizing that, the ability to store qualitative and quantitative data, statistically validate those SEGs and get that good decision making. So most of the folks we work with end up having a really good harmonized approach to exposure group management. So how they define their SEGs is harmonized, and how it's managed and how it's validated is all common platform, as well as the qualitative risk assessments themselves that make up the overall envelope of the SEGs and how they're managed and reassessed. And also having access to that hard quantitative data, whether it's historical or present day, having that at your fingertips in a way that is easily accessible but also communicates with other data sets so that you can actually make interpretations of data in a quick and efficient fashion. And those validation tools. So as long as you have your data in a good spot and you're able to retrieve that, you can run statistical analysis, run Bayesian statistical analysis to confirm that the professional judgment regarding risk is accurate. And of course, the decision analysis and reassessment tools all ties into that validation approach. And lastly, as we close, another important part is reporting and trending of data and communicating that. The differentiators that we've seen are they have the ability to efficiently get that data out in reports that's digestible not only to upper management, but to employees on the floor regarding the risk in their workplace and how those risks can be mitigated. And those that can have control of that data and get it out and reportable, find an easy go of it, better go of it all. I don't know, Joe, if you have any closing remarks.
No, No, you summed it up there. I mean, it's almost like a cradle-to-grave approach where you are going out into an organization, you're looking at your SEGs, you're determining qualitatively whether or not you need to, do some quantitative sampling, data, effective data collecting to make a decision as far as the exposure, and then reassessing it. So it's a continuous cycle of doing the risk assessments and managing your SEGs. So I thank you all very much for listening in on this webinar. And Monica, back to you.
All right. Yeah, thank you all for listening in. That does bring us to the end of our presentation. So we will turn it back to Ed to review the polls and answer the questions that have been coming in during the webinar. Thank you all again.
Okay, thanks, Monica and Joe. Let's take a look at the poll results here. Okay, the first poll question was, do you feel your organization has a well-defined list of similar exposure groups? And we had 22% answered yes, 29% answered no, and 49% answered partial. It is a work in progress. Monica and Joe, do you have any reactions to these results? Is this what you expected?
That was a bit what I expected and what we see in the field when we're implementing with clients. Is most do feel that it's their list is partial and it is a work in progress and ongoing.
Yeah, I would agree with that.
Great, thanks. The second poll question, there it is. Do you use the AIHA Exposure Assessment Strategies approach when defining and managing exposure groups? 75% said yes, and 24% said no. Any reactions to that?
For me, that makes sense as well. I mean, Joe mentioned, and I mentioned, I think, during the session that we implement globally. And even if we're working with companies in other countries, AIHA's Exposure Assessment Strategy is pretty well known and respected. So that jives with what we're seeing.
Okay, great. We'll jump into the Q&A section of the presentation. It looks like we have about 25 minutes or so for questions. Just a reminder, if you'd like to ask a question, please type it into the chat window on the right side of your screen and send to all panelists. First question, this is a question from Steve. Can you tell us how you would define SEGs in a large laboratory setting, which is very different than a manufacturing plant with many similar jobs using the same chemicals over and over? Would you suggest making a list of similar task groups?
Yes, that does bring up a really good point that I think Joe and I didn't quite mention, the challenges of research and development operations or laboratories where there's more dynamic activities versus companies that maybe, for example, a petroleum company or a mining company where the tasks are repetitive year after year after year. And for some of the clients that we have that are more R&D with dynamic operations that could change frequently, whether it's a new experiment or a new project that comes in, I think what I've seen, Joe, you can comment, I've seen mostly around job and task-based, really more granular definition.
Yeah, I mean, it really depends on what you want to get out of your SEG. Are you looking to manage the compliance with like medical surveillance activities that are associated with those agents? Are you looking to really define out and break those individuals out into groups for multiple groups for each specific agent, depending on the concentration? But there's lots of ways to do it. But like Monica said, it's probably task-based is your best bet.
And I think hopefully the profession, like maybe when we have additional presentations at the conference, I am seeing a trend where I think folks that are in R&D or with really dynamic operations versus those that have really repetitive operations are kind of in two different boats. I think some unique challenges for those that have those dynamic operations like you do.
Right, I agree with that.
All right, thanks. Next question. Does your software provide the validation tools?
We do have in Medgate the ability to export the data into Paul Hewitt's IH Data Analyst tool, and we can store the Bayesian statistical data results from that, the prior, the likelihood, and the posterior results that can help serve as validation against your risk assessment, as well as standard statistics. We store the data on your risk assessment so that you have the Bayesian and then you have the traditional stats that you can use in your validation. We have soon coming, we have partnered with Paul actually, and soon in the coming months we'll be releasing a fully interface with Paul's tool that's embedded in Medgate to some extent, and that hopefully will be the first part of next year. So we'll be further enhancing our interface with his tool.
Okay. A question from Amy. Do you ever put the same tasks under several different SEGs? And if yes, just duplicate or link the same task?
I can tell you how I managed mine. I was managing my SEGs based on by agent. So a specific task would be linked under multiple different agent SEGs, if you will. So, for example, if they were, if they were doing a certain activity that had exposure to noise as well as, lead, then that task would be linked under both of those exposure groups. I don't know if you have anything to add to that, Monica.
No, that sounds about right, and I think, again, it's very unique for each operation, so it's a tough question for me to answer without a lot of other information at hand.
Right.
So it does bring up the fact that I'm just going to stop there. It's a challenge.
All right, thanks. There's a question from Dave. Do you have any suggestions for small groups of 3 to 5 employees and very dynamic operations?
That's a tough one.
Yeah, I mean, you have to maximize, information of, management of change. I mean, defining if you have a small group of people, I mean, that makes it fairly easy go of it to define the SEG related to that. But, yeah, it's hard to define a long-term SEG on that operation if it's changing every few months. I guess the people we've worked with have direct communication with the line supervisors to have a good touch on the changes that are happening. And it does, I think that we should probably have some more sessions maybe at conference. I know with all the clients we've worked with, I guess I won't mention company names, but they raised that same issue. And I think that if you'll notice at the conference, it seems like a lot of the presentations on success stories of SEG management are many times companies that, are the petrochemical, they are the mining, they're these operations that are very repetitive and have occurred over decades, so they have a lot of good data. And I think the folks that are having the hardest time are folks like yourself dealing with, just dynamic operations that are changing maybe even monthly.
Okay, thanks, Monica. Question from Teresa. What is the minimum number of samples to collect per SEG?
Well, that's a really open-ended question. That really depends on the data set that's been collected, how many data points and the statistical analysis that you've done, both traditional and Bayesian, that would tell you whether that SEG has been adequately defined. So it really depends on the variability of the data and the outputs that you get through your statistical and Bayesian analysis. I mean, even just basic things like, if your GSD on your traditional stats is high, I mean, that's definitely a tickler for you to indicate that, that SEG is probably potentially mischaracterized. And I know that there's full courses out there for interpretation of traditional and Bayesian statistics in that regard.
Okay. Question from Jonathan. Please discuss strategies for managing SEGs where a process iteration is high.
Process iteration. Joe, would you, I'm not really clear on what
I wasn't clear on it either. I was thinking the same thing that you said, where process iteration is by.
We can come back to that question if Jonathan can chat in a little explanation. I'd be happy to read that one back to you later. Let's get to another one. Here's a question from Dennis. The most difficult decision is to develop the SEGs. Can you elaborate a little bit more with examples?
Well, as we talked about during the presentation, you know, defining your SEGs truly is one of those areas within industrial hygiene that's no two organizations really do it the same way. I know Monica can speak more because she does the implementations with multiple organizations, but I can tell you with my historical organizations that I've been associated with, it depends on the operations at hand, and the simplest way looking at those operations to categorize. We mentioned there's, you know, I know that organizations do SEGs based on job position. I managed mine based on agents. Some manage them based on tasks. There's really no correct way to do it. It's going to be based on each organization and the way the activities within that organization are performed. That's my sense on it.
Absolutely.
Okay. Thanks, Joe. Here's a question from John. Do you find any clients using tolerance limits to assess whether measured exposures are appropriate in lieu of Bayesian analysis?
I have not personally dealt with that
directly.
I haven't either.
Here's a question from Adamola. Have you dealt with organizations with limited historical data, and how have they handled this? What is the best way to handle lack of historical data?
Yes, we have. We have had organizations that are just starting an industrial hygiene program, and my recommendation when I'm talking to them from a sales standpoint is to, you know, the first thing they need to do if they're walking into an organization is look at things qualitatively. They can't just start, you know, jockeying the pumps and getting the pumps out there and collecting data. There has to be rationale. So my recommendation is always to look at your process, tasks, hazards qualitatively to determine your overall level of risk for each of those, defining an information gathering priority based on the level of uncertainty, and from there, getting the most bang for your buck and prioritizing and getting some samples to effectively document the exposures.
Okay. Here's a question from Douglas. How do you define a task versus baseline exposure?
I'm not quite clear how to define a task-based exposure. It basically goes along the lines of what Joe just mentioned regarding qualitative assessment and jumping into actual strategic quantitative sample collection and statistical analysis of data.
Looking at the task, looking at the hazards of the task, and then using the AIHA's Exposure Assessment Strategy to come up using the algorithm to determine the information gathering priority. I mean, that's the way I interpret the question. That would be my response.
Okay. Okay. How do industrial hygienists you work with manage the challenge of ensuring SEGs are not defined too broadly or too narrowly?
That's a common challenge we have across the board is dealing with, you know, defining your SEGs, and if you do so too narrowly, you know, you're dealing with a lot more SEGs to manage than you need to, versus defining them too broadly such that the SEGs you have defined are not homogeneous in nature for each respective SEG. And it's a constant challenge to do so. But you know, through that strategic qualitative and quantitative data collection and through the statistical analysis, you know, you have to hit the ground running at some point, and I think that can be the most challenge at times, is just getting your feet in the water and at least getting an initial list of SEGs presented, and realizing that those may need further characterization, but just getting that initial list done, whether they be slightly too narrow, too broad, that just get started, and then proceed with that data collection and further validation of whether the SEGs are truly homogeneous in nature.
Okay. Here's a question from Dirk. He says that I don't think many of the IHs I work with truly understand the value of well-defined SEGs. How should I make the argument that spending time on defining good SEGs is critical?
Yeah, I mean, there's the efficiency aspect of it with your limited resources, kind of calculating a return on investment regarding the fact that SEGs can help you efficiently allocate your resources, not just within industrial hygiene department collecting data, but also communicating to management on what controls need to be in place and showing that those controls were efficiently mitigating risk. And then I know one of my success stories I mentioned earlier is just the raw bottom line financially. Being able to get those, enroll people in SEGs if you do have them defined, and managing your employees in a more efficient way. I mean, in our example, we had one client just in one program go down from $1.2 million down to a $700,000 budget. So money talks sometimes too. I know that there's in AIHA, I know Bernie Silverstein and his return on investment tools, ROI tools out there. I don't know if you've heard about those and whether his committee or group are still working on that, but I know within AIHA and with one of our committees, they're putting or have put together some pretty awesome return on investment tools to show value.
Right. The one thing I would add to that is that, you know, I would stress to management how you're, you know, managing SEGs effectively is going to be the backbone for other IH-related programs and the management of those programs. And from a compliance standpoint and from a publicity standpoint, you know, avoiding negative publicity, that is, you know, SEGs can really help you manage those other programs effectively.
Right, and it just occurred to me the committee, Bernie's committee, I think it's called Value Strategies Working Group. If you look that up, there's some pretty awesome tools I think they've put together.
Okay, here's a question from Jonathan. Do you find many companies that group SEGs by the controls, for example, engineering or administrative, used for a specific chemical rather than by the job function?
I haven't.
No, most of the folks I've worked with are worker groups or teams or job or task-based.
Okay. Question from Gordon. How do you evaluate processes of variable noise exposure where the work environment is highly variable with noise sources?
Yeah, that's a tough one. I don't have any personal experience to give you a good answer for that. I don't know if, Joe, if you have anything.
No, I mean, that's that's a tough one. I mean, obviously, from an industrial hygienist standpoint, you would just take the most conservative approach, probably, and you know, put them all in a hearing conservation program. I mean, that's not helping with your SEGs, but you know, if the noise levels, you know, vary that dramatically, then I guess I would ask why. It must be some type of a mobile workforce, or you know, not a static activities. Yeah, that's a difficult question to answer.
I guess in the end, you're looking at different like subsets of exposure groups within that operation that you'll have to granulate, because you will have to focus controls on those areas that have higher exposure over lower.
Okay. Here's a question from Sharon. How do I convince my colleagues that regular sampling is required? They feel that historical data is enough.
That all goes into management of change and realizing that operations over time can change, and whether it be, materials, processes, work practices, that may result in possible variations of exposures that, they may require some additional sampling. So periodic sampling to capture that potential change would be important. Otherwise, you could miss out on some change that resulted in an elevated risk.
Okay. Here's a question from Teresa. I hope I'm asking this question correctly. She asks, how do you handle quote-unquote less than exposure data?
Yeah, censored data analysis. Many of our clients will, when they're running their statistical analysis, will deal with that data set either through substitution methods or MLE or log probit. I know within our system, we do have substitution methods available. The majority of our clients do use substitution, whether dividing by 2 or the square root of 2, the less than detection limit value, prior to inserting that data in the stat tool. And then tools such as Paul Hewitt's AIHA Data Analyst have, and I'm sure some other tools out there have even more robust tools, whether it be MLE or log probit, to handle that censored data prior, and during the statistical analysis that you may be performing.
Okay. What's the best way to keep track of employees who might move into a different job position or task where they will need to change SEGs or be added to new ones?
And I don't know if, Joe, you want to mention it on this one? Or?
Yeah, I mean, I know within Medgate in our tool, you have the ability to enroll individuals into SEGs based on their job position and their demographic hierarchy. So, and as that changes with your organization and is updated in Medgate, those individuals will automatically be enrolled and unenrolled in other SEGs based on that combination of job position and hierarchy.
Okay.
I don't know if that answers the question, Monica.
Yeah, I think so. I mean, at least with us, and I don't know if other systems do, but we have, it's an automated tool. So you define your SEG, you can define what jobs and work locations would draw someone into that group. And at least our system supports a regular HR feed, whether human resources data feed, whether it be daily or weekly. And as those feeds are running, the system can determine whether an employee is falling in or out of that job and automatically enroll or unenroll an employee in a SEG automatically, which is pretty valuable for those organizations that may have thousands of employees, and otherwise it'd be quite time-consuming to manually try to manage all that. And I must say there's kind of 2 phases for hygiene in that perspective with SEGs. I mean, first and foremost is just defining your SEGs and managing your industrial hygiene data around the SEG and making sure the risk is controlled. Secondary to that, which is a bonus, is being able to actually physically enroll your employees in that group. So you have fingertips on exact people that are falling in. And so we deal with, our users can do both.
Okay. Here's another question about incomplete historical data. How do you make the most of incomplete historical data sets, and how should we ensure that what we collect now will be useful on an ongoing basis?
Well, I guess you can do as much forensics as you can on historical data. If it's partial data and there's some questions about its integrity, or there's pieces of data missing that make you question its integrity, then it does become a little bit more difficult to kind of backtrack and determine whether you can get the missing pieces to feel more comfortable with the data. But we do have some clients that do try to do the forensics and do some legacy data cleanup, and whether going through paper files and trying to reconstruct and get all that data on a common platform that's integrated, that displays all that data in one place, is what they'll do. So it's quite a bit of effort to do that cleansing and investigation. And then for data going forward, it really needs to be a harmonized data collection and storage approach, whatever approach you decide to do, but it needs to be on a common platform with common metrics. So, you know, some people may collect samples and collect certain data points, but someone may collect different sets of data points, and you can have disparities. So harmonizing what critical pieces of data must be collected on a field-by-field level and mandating that that data be collected and stored in a certain place. And you can even, if it's a database system, make those fields required on the database so you can't complete the record until that required field's populated. So having those systems in place that kind of just push people to collect that data, otherwise they can't proceed with completing their work. So I don't know, Joe, if you have anything else to contribute to that.
No, I couldn't have said it better.
Okay.
Okay. We have time for one more question. What have you found in your experience working with multiple organizations on software implementations? What have you found to be the simplest way to manage SEGs effectively?
Yeah, I guess that just boils the whole presentation down. I mean, it's just really having a good command of your data and having that harmonized risk assessment approach to have all that data at your fingertips to manage your SEGs efficiently.
Right.
Okay. I'm sorry, Monica, did you have any other thoughts to add or any final thoughts?
Other than thank you all for your time and listening in. Hopefully Joe and I were able to share with you what we think is a pretty unique perspective of seeing some of the struggles that folks are having in the field. We have the textbooks and we have conferences that we go to and we hear things on how things should be done, and I think when the rubber hits the road there's some unique challenges, and I hope this serves as a perhaps an opportunity for us to explore more conversations at conference and have some more sessions about some of those challenges that we're having that they go beyond the textbooks, real world challenges. Thank you.
Okay. Joe, do you have any thoughts to add?
No, Monica summed it up perfectly. I mean, it really comes down to, you know, that especially with SEG management, it's not an exact science. So a lot of people struggle with it, trying to do it the correct way. And unfortunately, I don't think there is an exact correct way. It really comes down to each organization and what works best within that organization. Thank you all very much for participating in today's webinar.
And thanks to you too, Joe and Monica, for a great presentation today. And thanks to all of our listeners and to Medgate for sponsoring today's webinar. Please keep your eyes open for our next Synergist webinar coming up in spring